how big will the scar be after having a lipoma removal? Well, that is a good question, and that is something that needs discussion, I would say, because it kind of depends on two things. It depends on obviously how big the lipoma is, so the bigger the lipoma, the bigger the scar, but it also depends on kind of where the lipoma is, because some lipomas can be quite deep. That's why often we want scans and things for lipomas, because they can be quite deep. Because if they're not quite deep, if they're quite superficial and if they're quite close to the skin, it's actually possible to remove a lipoma through quite a small incision, because you can kind of squeeze it out and it kind of pops through the skin. But if it's deep and we have to go looking for it, then that's when the incision gets bigger. So I'd normally say it's about the same diameter as the lesion. Try and make it a bit smaller, but that's kind of the kind of ballpark you want to be expecting, about the same diameter of the lesion. But if it's, as I say, if it's close to the skin, we might be able to take it out through a small scar, and that's particularly for people who have multiple lipomas, because you can often do little stabs and take multiple lipomas out by kind of squeezing the skin and popping them out. So it is possible to take it out through a smaller incision if it's close to the skin. So that's something we'd really need to sort of examine you for, to see where it is in terms of how close to the skin it is. Because if it's quite deep, you might need a bigger incision.